I think the important thing about colorectal cancer is you have to be aware of your risk of colorectal cancer. Obviously, if you have a family history of colorectal cancer, then you would want to be screened a lot earlier. Okay? If you are just an average Joe off the street without any risk factors, screening should start at the age of 50. Now, there are a few options for screening. One of the options of screening is we can do what we call fecal stool testing. The advantage of a fecal stool testing is it involves a check of your stools once a year, and it is not invasive. You can do it in the comfort of your own home. You can bring it to the clinic or the lab and hand it to the doctor, and they can analyze it. Now, the disadvantage of it is that it is not very sensitive and it can miss certain cancers. Okay? The other option of screening is what we call a colonoscopy. Now, a colonoscopy is the most sensitive way of screening for colorectal cancer, and the current recommendations are that everyone should get it above the age of 50. Now, the main advantage of a colonoscopy is obviously the most sensitive way of checking for colorectal cancers. Now, the other advantage of it is that if you find a polyp or a precancerous lesion, you can actually remove it while you're doing the colonoscopy. That is something which the other screening modalities do not offer. The main disadvantage of it is obviously it is a procedure, so there are certain risks involved in it, and there are certain preparations that need to be done. So not everybody may be comfortable with it. You would involve giving fluids so that you can prepare your colon for the colonoscopy. And obviously there's also what we call procedural risk, because it's done under what we call sedation. And you can get reactions or allergic reactions, or sometimes you can get complications such as injuries to the bowel. But thankfully these are very, very rare. Injuries to the bowel occur only in about 1 in 5 to 10,000 colonoscopies.